Hi, my name is Alexandria Palmer, class SPCE 683, section 805. This is case study number 2. So the objectives that we're going to go over are state intervention goals in observable and measurable terms. H1, identify potential interventions based on assessment results and the best available scientific evidence. Is H2, recommend intervention goals and strategies based on such factors as client preferences, supporting environments, risk constraints, and social validity. H3, when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. H4, plan for possible unwanted effects when using reinforcement, extinction, punishment procedures. H5, monitor client progress and treatment integrity. H6, determine when consent and assent should be gained with a client. That's H2. Determine how to apply culturally sensitive interventions to your future practice as a behavior analysis. E7. So behaviors for decrease. Some behaviors that we are tracking for this learner is crying, screaming, and whining, which is increased volume, pitch, and vocalizations that is different from the learner's normal vocalizations and is not related to play and lasts for 5 seconds. This behavior must be accompanied by tears. For flopping, it's any instance the client falls to the floor or rolls onto the floor from their back from that sitting position when it's not related to play. So during transitions or during skill acquisition programs. For swiping and throwing, that's any instance that the client propels an item or items through the air or across the surface when not part of appropriate activities, such as throwing a ball. For elopements, any instance in which the learner walks or runs at least 5 feet or more from their therapist without permission or attempts to leave the room without therapist permission. This also includes just grabbing that door handle. For mouthing, it's any instance in which the learner puts an item or body part, including fingers, this learner likes to suck on the fingers, that is not meant to be in their mouth past their lips. Disrobing, removing, or attempting to remove any article of clothing that is not appropriate to remove. This frequently happens during snacks and lunches, anytime we get anything dropped onto our clothes, such as spilling our drink. This also can occur for when we're playing with the water table. And then I have aggression and SIB highlighted because those are ones that I want to go more into detail talking about because those are big ones. So SIB is self-interest behavior. Self-interest behavior is defined as the learner hitting their legs in a repeated manner or hitting their head against like hard surface, so such as the wall or the floor. And the goal for this one is the learner will engage in SIB for less than 5% of their day across 60 data collecting days. That's important. We don't want to do 60 days because then it'll count the weekends as well, and then it will master. For SIB, we collected ABC data on this behavior to see what the function was, and we came across 3 different functions. So those hypothesized functions are escape, access to tangibles, and attention. So for that, the intervention is made into sections by which function is occurring in that moment, so that the staff can go and see, okay, they're doing SIB, we were doing work, so it's for escape. So for those, for attention, we're not going to say anything, we're not going to do anything, we're going to ignore and continue about what we're doing. If the client is hitting their head hard enough on the surface to leave a mark, we're going to use a mat. So we always carry around a squishy mat to help block, so keep that learner safe. If it's hard enough to leave a mark, we'll call what we call a PM, that's just the BCBA. And then we're going to also always record data so we can show parents before these interventions even go into place, we will get consent from the parents that this procedure is okay to use on their learner. And then next is escape. So we're not going to say anything. We're not going to make eye contact. We're going to ignore and follow through with that program or command. If the client is hitting their head hard enough to leave a mark, just again using those mats, have reinforcers out and visibly visibly enticing to reestablish that motivation. We always want to have a scent. A scent is very important. So what that means is that they're motivated for something to follow a demand. If they do not want to follow a demand and they're just engaging in a behavior, um, they're not motivated. We don't have a scent, so we basically don't have consent to follow through. We always want to have that motivation. So we're going to entice and try and get the learner to stop engaging in the SIB and want to play with us. And then we can use that motivation for that reinforcer to follow through on a demand. And then for access tangibles, or if the antecedent is unclear to staff, this is the protocol that we will follow. So we're not going to say anything, just as the same as the above. We're not going to make eye contact. We're going to show the learner a choice board. So what a choice board is it is the laminated sheet and there's different squares that the learner can touch and say. So it'll be go if they want to switch room. They can man for cuddles. They can man for help. They can man for open. It just kind of gives that visuals so that they can pick, okay, I want cuddles, um, to help work through some behaviors. So we'll show them the choice board, grab new reinforcers to entice. If no choice is made, then we use those reinforcers and try and gain the motivation. If the SIB increases, we're going to call for support to help block, so that you can entice and the staff member can use that mat and kind of keep them safe. The client is saying their head hard enough to leave a mark. We're going to call that BCBA, also record data, and we're always, always, always going to carry that mat. So whenever there's a behavior for decrease, we always want to make sure that there's a replacement behavior going in. So that can include manning for reinforcers, manning for all done or a break, manning for attention, such as cuddles or tickles, or manning to switch classrooms. So that would be that learner saying go or choosing on a choice board to go. We always want to keep in mind antecedent strategies. So what that is things that we can do beforehand that's going to prevent this behavior from occurring, such as frequent preference assessments, following the schedule for this learner, and providing positive attention. The next one is aggression. Aggression is defined as using an open or closed hand or foot to strike another learner, biting another person's clothes or body, pinching, grabbing another person by curling the fingers around their skin, clothing, hair, and scratching, removing face masks or glasses, or even we're going to count those attempts. So, same as the SIB, the learner's goal is they will have less than 5% over 60 days of this behavior. For this behavior, when we collected data on it, it showed that it was mainly attached to the function of denied access and escape. So for that protocol, staff's going to immediately move to prevent further attempts, ignore as best as possible. So no verbal remarks, no eye contact, and no attempting to entice. A precursor is the learner likes to rub their fingers together. Once that occurs, we're going to move away to prevent any instances at all. Give the instruction nice hands, so just placing their hands like this, that shows that they're nice hands when they're ready. Do not give any other verbal attention outside of that demand. If the demand was presented, keep the demand in place while moving away. Once the learner is calm for 10 seconds and is showing you nice hands, which is that right there, return to whatever you were doing before the behavior occurred. If you had a demand in place, we're going to follow through with that demand. And it might be helpful to prevent the learner's choice board to give them that option, to help them kind of calm down and de-escalate. And a lot of the time, this learner will pick for cuddles. And then we're just going to honor what they manned for, if they're manning appropriately, and then record that data. So the replacement behaviors we can use for this are man for reinforcer, man for all done or break, man for a different classroom to go, and then man for cuddles. And then antecedent strategies, we can do frequent preference assessments, watch for proximity with staff and other learners, specifically after that first instance, and allow for 10 to 15 minutes of calming, that decompression, those sensory breaks, squeezes, calm music, and the lights down.